slides up. Do you mind sharing them?
Yes, I'm getting my computer set up right now.
Great. So we designed the Meet the Expert sessions so that people from the community could tap in every so often on a regular basis to the center so that we could give talks, but most importantly is interact. And we really want community engagement. We want to hear from you. We want to see what your needs are because we're inspired by the community. And so if there are things that I say today or talk about that you say, wow, that doesn't seem right, or that's not what I went through, please let us know because we want to make sure that what we do here at the Sean Parker Center at Stanford for allergy and asthma, we want to make sure that whatever we do contributes to society, contributes to the public good, and most importantly is helps people and their children or their family members with disease, and particularly with food allergy. I know that that's a big topic. We also are happy to talk about COVID and other things that our population's facing right now. And then we also want to be of service to doctors and clinicians and allied health professionals. So for those of you on the line that also have questions about that, please feel free to interrupt me. We are really excited to be part of the community. We feel very honored and humbly very happy to be working in food allergy for almost 20 years now. And that's thanks to really amazing teamwork and a lot of public support. So the only reason we can be here is because of people like you. And we also want to work together with industry to have better targets by which we can treat and prevent the disease. So like Katie said, we are focusing on both prevention as well as therapy. Today, I'll talk a little bit about our prevention work too. And I'll talk about this really cool study we're doing because, as many of you know, food allergy has been around our world for a while. Unfortunately, there was a steep rise in the 70s and the 80s in this epidemic, and then it's continued to rise since then. It's doubling almost every 10 years, which is more than just a generational effect. And so that's more than just genes. We know the environment plays a really critical role in food allergy. And so with that, when anyone in academia tries to study environmental contributions to a disease, it's always good to start with a birth cohort. And I know this seems strange because there's birth cohorts for so many things in our society, but there's never been one for food allergy. It's kind of amazing. So thanks to the NIH, they have, for the first time, started a birth cohort for food allergy. And it's called Sunbeam. And so I'll talk about that today. And hopefully for those of you on the phone that have patients or have family members with babies or pregnant moms that are going to deliver, this is for everybody to join, and it offers a lot of exciting things for someone to be involved in a cohort study because you learn a lot about your baby, you learn a lot about your pregnancy, and then you get tests along the way, and that can also provide you information in a research setting. So it's, I think contributing to birth cohorts is so great, not only being a personal participant in one, but also for the greater good of understanding a disease. Next slide. So the goals are what happens before birth and in early life that can cause infants to develop a food allergy. So again, we're taking all comers. We're not being biased. We want to make sure we take anyone and everyone that is pregnant so that we can follow long term and see, well, what are factors that someone delivers and has a baby with a food allergy, or what are those factors that someone without with a baby without a food allergy, what are the factors that perhaps protected them? So this is a really important question. Next slide. So, and many of you on the line might want to comment on this with your own personal experience, but there are people that are born with eczema and dry skin, and those are the children that tend to have more allergies in the future, like allergic rhinitis or what we call hay fever with food allergy, and then also asthma. And so you can see in this graph that there is this proclivity, or there's this tendency by which if someone has early onset allergies sometimes they are the highest likelihood of having allergies long term. However, at any point in this road, from baby to older person, it's cool that you can develop allergies anytime. In fact, anyone on this planet has a 1 out of 3 chance of developing allergies, whether or not that be to food, to environment, or having asthma or eczema. Next slide. And as you all know, the food allergy epidemic, it's one of the many epidemics we have to deal with right now during COVID. But even though we're trying to have vaccines and good therapies for COVID, and it will probably be among us for a long time, it'll probably go down in its epidemic proportion, but food allergies certainly will not. It really seems to be growing, and we need to tackle this. Next slide. When we look at the causes to try to think about prevention, there's environmental influences, and we list them there between good microbiota and good feeding experiences during birth to negative ones like pollution and stress and eating fast foods. We know that epigenetic changes occur when you do eat fast food or you smoke. They can change our DNA to the extent that that can be passed on to the next generation. And then contributing on top of that is just the inherent genetics of any given family. Many of you probably know that food allergies can, but a lot of times it does not. And 65% had allergies in their family prior to that. So that's why we really need to understand the contribution of environment and genetics to the etiology of food allergy. Next slide. So this is the study. This is the buildup of the birth cohort study. We are enrolling pregnant women. Anyone you know who's currently pregnant, we're going to start the study very soon. And then after birth, there's only 5 visits, so it's really a nice study, very quick in and out of our clinical unit. And it, again, is really exciting. I think a lot of people like to be in these types of studies because it helps their children, it helps the mom really get a good sense of family and being together with a family of investigators where we're testing a lot of things on the baby, but not contributing to any pain and not at all, that we actually are trying to look at these visits where we assess for disease over time. You can see these different time points at 2 months, at 5 months, at 12 months, at 24 months, and at 36 months. But during that, we get to talk to the moms, get to see the baby. I think there's a lot of contributions of science that happens at the bedside, and it's a nice way for people to interact and find out whether or not their child is developing an allergy or not. And with that knowledge, go to a specialist and help manage that disease. And as we know with allergy, if you can capture and catch the disease earlier than not, you can prevent a lot of the downstream consequences of having bad reactions. So not only is this important to do for the progress in science and understanding what the causes of food allergy are, but it also can hopefully help each individual patient and family. Next slide. So pregnant, please get into the our hospital is very safe. It's in Mountain View, and everyone in the door gets screened. We've never had anyone get COVID at all. All of our staff have been vaccinated, and so everyone wears masks, of course, and hand sanitizers and stays socially distant. But importantly is we've been continuing through COVID to enroll patients in all of our studies, including this birth cohort. And we're so excited to work with you in the community. And this is an incredible opportunity to give to science. Are there other slides, Tina?
No, that's
okay.
The last one.
So we have 15 minutes. And okay, great. And the first question is, could you compare and contrast OIT versus microbiome therapies for food allergies? Sure. So microbiome therapies like include yogurt or taking samples that include giving bacteria back to your gut. And we know that those alone possibly cannot cure the disease. We know that oral immunotherapy, which is giving the food back to the gut, can also help. We know that there's been good effect with that, but we need to improve safety. So there's a lot of new therapies now to try to look at safety. There's blocking antibodies. There's different ways to make sure that the gut isn't as affected in terms of any features that could be unsafe. But microbiome can help improve safety and perhaps help improve how the immune system adapts to therapy. So I think there's always a role for microbiome, and it's always good to have good microbiome in our gut. So instead of sort of contrasting them, to me, I believe that they should be synergistic. They don't have to be competitive, and that during oral immunotherapy or during any therapy, one should have a complementary, great bacterial system in their gut. And I'm happy to offline give some more direction around that. But these are great studies, and I think the microbiome is going to play an important role in a lot of things that we do. Are there any other questions? Okay, here's another one. Do allergy kids have a higher risk for cytokine storms due to their hypersensitive immune systems? Great question. So, cytokine storm right now, not just in children, but also adults. So it's a great question, but right now we have not seen that to be the case. Children with allergies and eczema in particular tend to have a lot of what we call histamine, and it activates their brain. It makes them more sort of what we call quote unquote hyperactive, but they don't have hyperactive disorder. It's just because they're in a state where they're more energized. And so what's important to know is that that doesn't necessarily mean that they're going to get more cytokines in their blood. It just means that they might have more histamine, which is a different type of chemical in their blood. All right. And the next question is the study for moms who have food allergies or for right? It's for both. The moms that come into the study could either have food allergies or not. We want everyone to come in. And we definitely want to understand for those that have food allergies versus those moms that don't, what's the contributory features of the mom that had the food allergy to the child versus not. So these are all great questions, and that's exactly why we want to study this. The next question is, have you done any research on moms with food allergies and anything we should be aware of during? Yeah, lots of research on this. So moms that are food allergic should obviously not eat the food that they're allergic to, except if they're undergoing therapy. There are pregnant moms who've undergone immunotherapy for their foods while they're pregnant and have done okay. There are a bunch of studies for women who are pregnant in general, and importantly, studies have come out to say, please eat nuts, please eat a good balanced diet, please eat good green leafy vegetables, avoid fast foods, avoid smoking, drink lots of water. So for those moms that have maintained that diet during pregnancy and breastfeeding, their babies tend to have less allergies. But I don't want to put anyone through a guilt trip here. It's not like it's a perfect world. Even if you do all those things, you still might have a baby with food allergies. And you still, as an adult, might get food allergies as you grow up. I mean, you saw the data that I showed in this other slide. 1 out of 10 adults have food allergies. 1 out of 13 children have food allergies. So we always have to also make sure that people know, how can I prevent myself from getting food allergies as I get older, pregnant moms or anyone. So I think eating a good, healthy diet is important. But right now, there's no reason to believe that while you're breastfeeding or while you're pregnant, you should avoid good food and nuts. So that's the data. The next question is there anything pregnant women can try and reduce the weight? Oh, yeah. Well, I just kind of went through that a little bit. So if a pregnant mom makes sure that they avoid these certain things like high degrees of pollution, smoking, fast foods, those are the things that tend to increase the risk of having a baby with food allergies. Making sure that your own skin is protected and smooth and hydrated is really important. If you have eczema as a pregnant mom, make sure you talk to a dermatologist and get the right solutions on your arms and legs and wherever the eczema is to keep track of that skin disorder. But in addition, when you do have that opportunity to try to prevent a disease, which you can, you have enough information in your hands now so that eating well, eating nuts, eating diverse foods while you're pregnant and breastfeeding is very helpful towards improving the likelihood that your baby will have less allergies. The next question is the study site only for people in Northern California? No, it is not. Great question. There are sites around the country that will start enrolling pregnant women. So that's really exciting. Is there any recommendations on what mothers need to eat or not eat? Already have one child with allergies. Well, no, if you already have a child with food allergies, please, while you're pregnant or breastfeeding, eat what you can tolerate. I know there's a lot of aversions anyway when you're breastfeeding or pregnant, so don't eat what you think you don't want to taste. But importantly is try to diversify the diet early and often while you're pregnant and breastfeeding. And even if you have a child with food allergies, you should do that so that the second child might be less likely to have food allergies. Are there any children of parents with anaphylaxis more likely to develop? I see. We've studied this. There are some parents that had really severe peanut allergies, and we followed their children, but it didn't really show that their children had a higher likelihood of peanut allergy or anaphylaxis. The only thing that really tracks well between parents and children in terms of an allergy is a drug allergy. If a parent has a really severe drug allergy, same drug allergy with the same degree of reaction, refuses to even try new food due to fears of reaction, how can he stay on OIT? Oh, great question. Well, this is really a topic that maybe Katie Fast and others can talk about, but we absolutely think it's possible. We work with the child. We have a wonderful behavioral specialist on site. Most people, in fact, all of the kids typically say they do not want to have or eat this item and even try it because they have an aversion to it. And people have been told to avoid this thing their whole life. So why should I eat it now? And so you should try to come in and see our center and see how we do it, because we definitely take that into consideration. We would never force anyone to eat anything. That results in something really an unintended consequence of eating disorder. What we work with the family, work as a team, and make sure people here together they're going to be able to eat that food in the end and not have to worry about having a fear of food allergy. And that's our goal. And so most families are willing to move forward with that. And of course, we do it really carefully. We go very low and very slow so that we try not to have any side effects. So that's how we can try address that fear and that worry in any individual, because we understand that fear. In fact, we talk about it a lot, but we want to make sure we address it safely and carefully and slowly so that no one has to worry about having a bad reaction. Last question is, should pregnant women be taking probiotic like Culturelle? Yeah, I think everybody should be taking a probiotic and taking some Culturelle. I don't work for any of these companies that make these products, so I don't want to be seemingly promotional of one versus the other. But I do want you guys to know that any kind of fermented foods, my colleague Christopher Gardner and Justin Sonnenberg, they're fantastic, and they're doing studies on whether or not a high-fiber diet or a kombucha alone diet or a fermented food alone diet or yogurt-laden diet, which one is better. And so far they've seen it's fermented foods. So if you can have at least 3 portions of a fermented food, either kombucha, not a lot of high sugar yogurt, but just that's better than taking something like Culturel. Okay, I hope that's helped everyone. I know we're coming against the hour, but does that seem okay? Are there any other questions? And if people email, Katie, is your email on this webinar series, or is Tina's email on the webinar series?
But mine's on the Thursday one. But a look at the Sean Parker Center webpage will show my email.
I also
Okay.
posted a general email address.
Okay, great. So if anyone, awesome. So Tina, cool. Awesome. Thank you. Now, if anyone thinks that I've said something today that fell off, that felt sideways, or felt that it wasn't right from what you're hearing from your own doctor or your own allergist, please let me know. There is a lot of new data coming up. We like to make sure that we're up, and doctors are really busy in their clinics, and sometimes they might not hear about some of this data. And so sometimes you, as the patient, have this amazing position as an ambassador of knowledge to help each other and to pass on knowledge. So if your allergist or doctor thinks otherwise or has another opinion, please let me know. I'm happy to talk to them and in all humility find out what they know that they might say, no, that's a resource. But sometimes it can go some, any suggestions or any recommendations we make from our with randomized controlled trials to back up anything that we please use us as a resource. We're here, one of the education resource to the community. So that's what we feel is our duty and our purpose, and we're happy to do that. So if anyone does have any additional questions or thoughts or comments, or if you talk to someone else and they have a comment, please feel free to use the email